Quote, I considered passing away in hospice care at my San Francisco Bay Area home, but even with palliative medication, I could develop potentially morphine-resistant pain and suffer personality changes and verbal, cognitive, and motor loss of virtually any kind. Because the rest of my body is young and healthy, I am likely to physically hang on for a long time even though cancer is eating my mind. I probably would have suffered in hospice care for weeks or months, and my family would have had to watch that, end quote. That quote is from a CNN article written by Brittany Maynard. Maynard was 29 when she was diagnosed with aggressive brain cancer. After having part of her skull and temporal lobe removed in an effort to stop the tumor growth, she learned it had been unsuccessful, and that is when Brittany began researching dying with dignity laws. Dr. Timothy Quill and Bernard Sussman defined physician-assisted death as the practice of a physician providing the means for a person of decision-making capacity to take his or her own life, with a prescription for barbiturates that the patient takes him or herself. The physician's only role is making lethal means available to eligible patients. The patient then chooses when to use those means. Many consider physician-assisted death to be the same as suicide, however, there is a difference. Andre Picard, a columnist for the Globe and Mail, describes it best when he wrote, suicide is an act of self-harm that is almost always a byproduct of a mental illness like schizophrenia or severe depression. This is no way comparable to hastening death via a methodical, sober process with a number of legal safeguards. Ask any terminally ill patient with less than 6 months to live if they want to die, and chances are they'll say no. Patients seeking physician-assisted death feel that if they can't control the illness, they should at least be able to control how they die. Cancer, ALS, chronic lower respiratory disease, heart disease, and HIV/AIDS are the top 5 diseases that patients seeking physician-assisted death in Oregon are dying from. According to the U.S. News article, Here's Who's Using Oregon's Death with Dignity Act by Lindsay Cook. Oftentimes patients seek physician-assisted death not only for a sense of control or how or when they die, but also because of how the disease makes them feel. The patients don't just feel the physical effects of weakness, nausea, excruciating pain, along with the loss of motor control and bodily functions, but also the psychological symptoms of a loss of sense of self, fears about the future quality of life, or becoming a burden to their family. According to the New England Journal of Medicine, patients who chose assisted dying had a greater control of their symptoms, and they and their family were more prepared for and accepting of their death. Death is not easy at all, not for the patient or their family, but it can be more peaceful. In order for a patient to request physician-assisted death, they must meet criteria. As of today, California, Colorado, DC, Oregon, Vermont, and Washington have legal Death with Dignity Acts. Montana also has a court-approved Death with Dignity Act, and as of January 1st, 2019, it will be legal in Hawaii. To be eligible for the act, a patient must be 18 years or older, a resident of that state, diagnosed with a terminal illness with a prognosis of less than 6 months to live, and must be mentally competent. The patient must be able to self-administer and ingest the medicine, and 2 physicians must determine if all the criteria has been met. Sandra Norman Eady's article on Oregon's Death with Dignity Act lists the following steps to obtain the prescription for lethal medication from a licensed physician. There must be 2 oral requests made no less than 15 days apart to the physician. The patient must also provide a written request witnessed by 2 people. The prescribing doctor and consulting doctor must confirm diagnosis and prognosis and determine if patient is capable. And if either doctor believes the patient's judgment is impaired by a psychiatric or psychological disorder, they will be referred for a psychological exam. The prescribing doctor must inform patient of alternatives like comfort care, hospice care, and pain control. And last, the prescribing doctor must request, but may not require, the patient to notify next of kin of the prescription request. In most states, doctors must watch a patient's body and brain inevitably decline until death mercifully comes. There are 24 states, including Ohio, that are considering Death with Dignity acts in 2018. On January 24th, 2018, Ohio State Senator Charlotte Tavares introduced Senate Bill 249, the Ohio Aid in Dying Act. The bill is supported by Ohio End of Life Options, which is a non-profit organization whose goal is to help people legally achieve their wishes for a peaceful and dignified death. The organization educates and advocates activities regarding end-of-life choices and supports proposed legislation similar to Oregon's Death with Dignity Act. So what can you do to support the Ohio Aid in Dying Act or other physician-assisted death acts? You can urge your legislation to vote in favor of the bill by writing or contacting your state senators. You can join the Death with Dignity movement. You can share your experiences and help educate and advocate. The liberty to think and decide what is best for your life is one of the greatest freedoms we have. Yet there are many that do not want the option available when it is of the greatest importance at the end of life. Physician-assisted death is a practice of providing a terminally ill patient who meets criteria the lethal means of ending their life. The patient must be 18 years old and of sound mind with a prognosis of less than 6 months to live to be eligible. It is a growing concept that is only legal in 7 states but is gaining more attention and being taken into consideration in numerous other states. Physician-assisted death is a practice that allows a terminally ill patient to end their life on their terms, in their way, and when they are ready without losing their pride or dignity. Thank you.